Lovely to see you all. We'll start off today's session with just a little overview of where we are. There haven't been any major government updates. So we'll just do a recap really of the news from previous weeks, but it's an opportunity for you to have access to these slides if you've not had access to them before. And then we'll move on to the main part of our session today, which is looking at improving communications with our statutory partners. And we're really, really lucky today to have Sarah Perrett from Adult Services at Dorset Council to come and talk to us today about the new initiatives that are going on within the council. And then we'll look at doing breakout rooms as an opportunity to talk to you in slightly smaller groups to really get your insight on how we can make communications as positive and effective as possible moving forward. Okay, so lovely. So I'm just going to share my screen now. So Ray, if you can give me a thumbs up when you can see that, that's fantastic. Thank you. So we're moving now into lockdown 3. I say we're moving into, my goodness, we've been in lockdown 3 for quite a while, but we're still here. The guidance link is at the bottom of the page. So if you do want to go to the full guidance, and we can also signpost anybody to the actual legislation if that would be useful to you. But the guidance does give most of the information that you need. So the central message as we move into, in this lockdown, is stay home, protect the NHS and save lives. This is the same message that we were using in the first lockdown. And the reason for that is that we're trying to keep the message consistent. So if you changed any of your messaging in your building or in anywhere where the community is still accessing, it's really important to go back to that first message so that we keep a consistent message right across the system. And why are we doing it? Well, we're doing it for the safety of others as well as the safety of ourselves. We're also doing it as an opportunity to try and get the virus down so that as the vaccine rolls out, we can have the maximum efficacy from our vaccines. And what do we mean by stay at home? Well, this is the summary from the guidance as a reminder of what we do mean. And we mean keeping it local as much as possible. So if you do have to go out, you're traveling as short a distance as you can. Now, there are some exceptions: going for work, volunteering, traveling as part of your bubble. So in order to see a single other household, one person that means within another household that's formed a bubble with yours, or if you have bubbled with another household as a single person, you can travel between those areas. But aside from those exceptions, what we're looking at is keeping it as local as possible. And why? Well, if we have a little look at the stats for Dorset, what we can see is some really encouraging news. We can start to see, if we look at that first graph over here, that we're seeing a downward trend when it comes to cases, and that's fantastic news. And it is hopefully a real sign that the lockdown is working. The first bar that you can see is actually Bournemouth, Christchurch and Poole. So the high numbers that we've seen have actually been way above the national England average. And that's really significant when we're talking about the numbers coming down. So although it's really encouraging, it's not to get too complacent about those figures. The very sort of pale greeny yellow colour shown here is Dorset. And what we can see is that Dorset's been running below the national average quite considerably, quite high within the southwest average. But probably the most concerning is that we're seeing a much, much slower come down in numbers than they are in other areas in the southwest. So this is definitely not a time for complacency. These numbers are far too fragile and could easily start to go the other way if people take their foot off the brake. So it's really important that we continue to do what it is that we have been doing so well in Dorset, and what we're seeing across Bournemouth, Christchurch and Poole, seeing those numbers come down. But the numbers are coming down at a slower rate than they are across other areas of England. And so that is a reason why we have to continue doing what we're doing. And you can see here when you look at the average case rates. So the second bar, and actually it might be easier if I just spotlight my pointer, make it a bit easier to see. So if we look at the case rates here, what we can see is that actually, although Dorset has done very well overall, we're still running at a higher average than we're seeing in the southwest generally. And that's really the area that has very similar geographical and demographic makeup to ourselves. The other reason we can't be too complacent is if we look at hospital bed stays. And of course, we can see here this dramatic rise post Christmas. And what we are starting to see is some levelling off, but this is levelling off at a critical level. So these kind of numbers cannot be sustained for a long period of time. So it is crucial to our NHS to see these numbers start to come down. And that means continuing to do the amazing work that's been done already. Just trying to change slides. There we go. So it's an opportunity just to have a recap to the support that is available. So if you work with anyone who is clinically extremely vulnerable, and remember that is a particular list of people, and you can go onto the government website in order to look at who exactly is included in that list. Anybody who is in that list will have been advised to have started shielding again during this lockdown. So that's a clear indicator that they are what we call CEV, clinically extremely vulnerable. There is help available through the council, and it's really important that we promote that as much as possible. People who are shielding can feel incredibly isolated at home, and also can find it very, very difficult to do things like shop, get shopping get delivered to them, go out to the shops at a safe time. And actually there is help available to keep those people shielding as much as possible. And that help has also been extended through our voluntary services, through the Volunteer Centre Dorset, to help people that are isolating as well, because they have been given an alert from Test and Trace that they need to stay at home. So there is help available, and it's really important that we promote that. And it's a good, responsible thing to do via your websites or any e-news, or if you're communicating at all with your beneficiaries, really important. And the link is here. It will take you to the council support. Other important support that's available is the one-off £500 grant for people on low income who are being told to isolate. And that's a help to be able to buffer the difference between the money that they had coming in and the money that they won't have coming in during a period of self-isolation, particularly if they're not entitled to support from their employer. Remember that we've got the Reach Out project being run by the council, supported by Citizens Advice Bureau. So anybody who is having financial difficulties can get in touch, and I'll do those telephone numbers later. But this takes you to a range of support that is offered via the council. And help around furloughing is available through Citizens Advice as well. So support that's available to organisations. You will have been aware, particularly if you've been coming to these webinars, that there was a new retail, hospitality and leisure business grant that came out, and that had two strands to it. One was for businesses that were closed, and the other was for those that were severely impacted by the lockdown. These grants have now been paid out automatically to all organisations who registered for the November lockdown business support grants. So if you haven't received any money from those grants for your rateable business, then it is worth going and making sure that you are registered, and the link is here. If you didn't apply for the November lockdown, but you are eligible for rates, so that could be that you currently don't pay any, but because you're a charity or you're a community interest company and you've negotiated something with your local council, you could still be entitled. So if you are eligible to pay business rates, then it is really important that you make sure you've registered your business. There isn't a deadline on that, but of course there is a finite amount of money. So if you think you're eligible, register and find out. You've nothing to lose by going through the process. There's also still the job retention scheme that is still running. You don't have to have previously furloughed employees to be eligible. It is flexible now, so you don't have to furlough employees for all of their hours, just some of their hours, if that would help maintain your business. But they must have been employed before the 30th of October to be eligible. And there's also been extensions of the Self-Employment Income Support Scheme, which will help any that are registered as self-employed. And that can be particularly beneficial to members of our community who are in the arts and maybe self-employed. Again, you don't have to have registered previously, but of course there are certain criteria that you have to be able to meet in order to be eligible. And there is support available for people that may be out of work or off work because of coronavirus. And there's a link down the bottom to support that. We talked last week about some of the help that's available around broadband access and data access for people that are really struggling. Working from home puts a real strain on the broadband, as does homeschooling. And so you may not previously have had issues in your house, but you're finding you're struggling now. And this is just a little range of things that people can check, but also again to support our communities, particularly those that are more likely to be digitally excluded. So do use the upgrade checker to see if you can upgrade for super fast fibre. It's not something you're notified about automatically, so it may well have been put in your area and you just don't know, you have to apply. There's the universal service obligation, which is managed by BT for people that are on low income. And the benefit of that means that you could actually be getting broadband into your house for about £10 a month through that scheme on low income. So it can make something that normally wouldn't be affordable. For homes that are getting poor broadband service, but have a fair mobile signal, the 4G home broadband can be an option. And this is something that's available for low income and people on ordinary income as well. Satellite broadband can be quite useful because it can access anywhere. So if you don't currently have a mobile signal or broadband, satellite broadband could be an option for you. And that link just takes you to Google, but it takes you to the site for providers that support Dorset. And then we have two further options for people on low income. There's the BT Basic broadband and phone, and they can offer support in getting you online as cheaply as possible. And there's also the low income mobile data. Many of the mobile phone providers have put special deals on to give people free or very reduced cost data on their mobile phones. This is particularly helpful for families that are currently only using data to support the homeschooling of their children. If you know of a family or somebody who may be eligible, they apply through their school. So that's who they need to get in contact with. And there's some really useful information provided by, I have to remember who they are, Tech Advisor on that bottom link, which can help give more information about that scheme. There is a handout that will accompany today, which is quick fixes for broadband that was put together by Dorset Council, which we will support and make available to you as part of the overall package of resources at the end of today's session. And then we mustn't forget the local community support that is available. You can obviously print this off as a slide and you can make it available to people in your community, but also it's useful to have it to hand for anybody who may be manning a phone line during this time. And the digital champions are there to support anybody with digital issues. That's anybody at all who may be struggling with access to IT, whether that's through skills or it could be that it's actually having access to IT equipment. They can help. And of course, we've got the handout that we talked about just. So these are some of those helplines that I talked about and said were available. Remembering us, we're here on our helpline between 1 and 4 every Tuesday, and you can speak directly to an advisor if you've got a quick question that you would like answered. But you can also access us by going to our inquiry page, which will take you to a simple form, and you can just put in your question and somebody will get back to you to support you with whatever it is that you're struggling with at the moment. And this is on top of our regular appointments that you can, of course, ask to see an advisor and have a dedicated one-to-one advisor time to be able to talk through the issues that your organisation may be having. Sorry, I actually clicked on stop shared. I just need to go back. I haven't actually done that before. That's a new one even for me. So sorry about that. Instead of moving on my slide. So just a quick note really about the vaccinations. I think more and more people are starting to wonder when they will be called for their vaccination. And that's understandable the longer that it goes on. That people start to become anxious that they're being missed. But the real message that we're getting from our NHS partners is please don't contact them. The time that they spend dealing with telephone calls, explaining to people that they will be contacted when they're eligible for their vaccine, actually gets in the way of the delivering of the vaccinations. So we need to be patient, and we need to wait to make sure that we hear, that we be sure that we will hear at the right time when we are eligible. And just to give some kind of figures of where we are across Dorset, you can see we've done over nearly 111,000 vaccinations, and that's as of the 24th of January, which was the last data that I was able to collect. So we've exceeded that now. And 83% of people over the age of 80 in Dorset have been vaccinated with their first dose, which is extraordinary work and takes amazing levels of cooperation to get that done. So thank you to everybody who's been involved in that. And just finally, a little reminder that you can get involved in that vaccination support. If you yourself previously gave vaccinations and would like to be involved in and actually providing vaccinations, then there's a link there to join our Dorset. We're not using any volunteer vaccinators in Dorset, so everybody that will be vaccinating you is fully qualified to give those vaccinations. So everybody is employed and under contract. We do have, though, volunteer vaccination marshals, which are exceeding probably even what anybody could have imagined. Over 2,000 new volunteers have come forward to be vaccination marshals, but we still need more. It's an ongoing job that's going to take us right into the summer, so the more the merrier. So don't think, oh, people have done that already. No, we're still looking. And then just general volunteering. If you would like to register to support the COVID-19 response in Dorset, or you are a COVID-19 response group, make sure you're signed up to Volunteer Dorset so that you get all of the regular updates that you need to have. So now I want to stop sharing and it won't let me click. So thank you for bearing with me, particularly as my came out and went back in again. That's a new one for me. So that update will be available on our usual place on our webinar page on our website, and we will make sure that anybody who needs to see that will be able to. But I'm going to hand over now to Sarah Perrott to introduce the Better Days programme and to talk through the initiatives that the council are doing to widen the offer for the residents of Dorset. So I'll hand over to you, Sarah. Thank you.
Thank you, Paula. Okay, I hope I'm not going to bore you all too much with my death by PowerPoint, but okay. So I've got a slideshow, and here we go. So hopefully this won't be new to you, but as always, the council is, sorry, let me introduce myself first. I'm the Commissioning and Service Development lead for the Better Days project, which is run by Adult Services over at Dorset Council. And the Better Days project is part of the transformation programme, yet another transformation programme that has been led by the council and is part of the Better Lives wider programme. So some of this is a bit dry, but it was worth. So the Better Lives programme is a programme that looks at, as it says on the tin, providing a better life, or looking at a better life, the best life that we can provide or help anybody that requires support to live. And in Dorset, so we've got an overarching stakeholder advisory group and a Better Lives governance group. And under those groups, you can see here that Better Days to Build a Better Life is our workstream programme. There's also great partnerships, right systems, and over here, I can't remember what, too far the other way now. Sorry. So if we're going to concentrate today on the Better Lives programme, which is the programme I'm connected for. So what the programme is for myself, I've worked in the adults commissioning team for a number of years, and I've been seconded for 18 months to look at how we can improve services to Better Life. And then, you know, under the Better Life banner, we are tasked with connecting to our community, promoting wellbeing, increasing independence, and looking at pathways to employment. And as part of that, so the most interesting, I think, the most engaging part of that is we've just started a huge programme of engagement with anybody that receives any kind of daycare service in Dorset, and that is also been sent to carers and anybody that's got, say, any interest. So 16,000 questionnaires have been sent out with a view to trying to seek people's views of how we can improve their life. And there's a set of telephone surgeries and phone-ins, and also the ability to complete a questionnaire over the internet. And then based on that is where we go with the Better Lives programme. So I think the bit that really is key for me is having worked at the council for a number of years, I do feel that I'm able to say that in the past, when we may have said that we have done engagement, that we have actually said, well, here's option 1 and here's option 2, and which option do you think that you'd like to go for, where, you know, we are hoping that we will really get some good feedback. So under the Better Days banner, connecting to your community, so transport, so we're looking at transport, and transport always comes up with any engagement work that we do. We're working with the transport team, looking at how we can reduce the size of buses, reduce fleets, how we can reduce the necessity for people to be transported for an hour to get from home to a day opportunity, you know, and then spend a couple of hours in day opportunity and then be bussed home. So we're looking at all of those kind of options. We're working with building better lives. As I say, this is about people being able to achieve the best life that they can. And access to local activities. So I can sit at home and design and come up with all these weird and wonderful creative ideas that I think that people would like to do during the day. But actually, people need to access the local activities in the community, the activities they want to do, not what somebody else, you know, is commissioned and thinks that are suitable for them to be doing. Part of the promoting wellbeing, so trusted partner reviews. So what we've done is Tricuro, who are our local authority trading partner, we trained some of their staff to undertake reviews. So we're actually instilling some confidence in some other people doing those social work reviews. Again, we're looking at the day opportunities. We've mapped all of the day opportunities that are currently available, and the engagement will influence what we need to be putting in place for the future. And also there's a carers survey that's gone out that we've had some questions added about what would a better day look like for people in the future. And under, you know, increasing independence, we're looking at increasing technology. And I think during the lockdown, it'd be fair to say that the day opportunity providers that are out there, during the first lockdown, they had to shut completely. Then many of them switched to Zoom and started to do quizzes, coffee mornings, Zumba classes, and really sort of kept in touch with anybody that receives a day service. And as with other projects, I think it's one of the good things that came out of a lockdown, if you can have some good things. And what we really need to do is to increase our use of direct payments and individual service funds, as well as commission service. So a direct payment. So at the moment, if you choose somebody that we support chooses to have a commission service, then they will have an assessment by a social worker, and that social worker will arrange everything for that person. If somebody that is assessed by a member of the social work team decides that they'd like to manage their own finances, they can take a direct payment, and once that direct payment is handed over, then that person and their team of supporters can then go out and identify where and how they'd like to spend that direct payment. And what we're also trying to encourage in the future is an individual service fund, which is not a commission service and it's not a direct payment, but kind of sits somewhere in the middle. So what we would do, for instance, is we would come out and assess your care needs and agree with you what your outcomes would be. And and you would then make the decision that actually, although you don't want the council to be commissioning your services, you also don't feel that you want to be in complete control of that direct payment funding. So we have a sort of third party broker or provider that sits in the middle, and you as the owner of your service negotiates or agrees with that third party provider how that money would be spent. So it might be that that provider would provide some of your support, and then they would agree, so perhaps a daycare provision somewhere else, or you would have a personal assistant set up, and the council are very keen to move forward with individual service funds for the future. And then the pathway to employment. So we're just about to go out to tender with a huge supported employment contract to help people in Dorset have some gainful employment. We've done a lot of work with people like Dorset People First, spoken to a lot of the people that support there, you know, and there's a lot of people that like to volunteer and also like to partake in gainful employment. Sorry. So with regard to the engagement that I spoke to earlier, I just really wanted to give you an idea. So we've sent out 1,600 surveys in January, questions on the carer survey. We've got an online version, some telephone surgeries, and some provider-led feedback sessions where we've asked our day opportunities providers to hold those sessions with the people that attend, so that they don't feel that they need to give, that people that don't have to, sorry, what we don't want is for people to feel that they need to give the answer that the council wants them to give, because I really don't. What I'd really like to hear is what people would like to do during the day. So we've gone from January through to the end of February, and we plan on giving some feedback during March, and then with the view to starting some true co-production work in April, which is really exciting, and hopefully we can evidence that it will be true and exciting. So the questions that we're asking on our survey, or asking for people that do receive support, is what does a good day look like? What's important to people? What would people like to be doing? What do you think about day service and opportunities, and people's aspirations? And I think we may get some interesting responses. If we'd asked the same questions before we'd gone into any form of lockdown, a lot of people would have still responded that they like to get on the bus with the day service every day and then get on the bus and come back. And I think during the lockdown, as I say, during this third lockdown period, we have a number of providers that have remained open, providing safe space provision to support people and to support their carers. We've got digital provision, we've got interactive activity packs being delivered, and some really good provision out there across the county. So I think we'll get some different responses where people will think differently about the things that they've been able to do. So the Building Better Days programme, what we want to do is identify a range of day opportunities in Dorset. When I say a range of day opportunities, that doesn't mean commissioned services. So I know that a lot of you will be out there supporting people in your community. And what I'd really like to do is tap in and find out how some of the people that are going to respond to my survey are going to tell me that they want to, for example, go for a walk in the country, go in the countryside, or I don't know, go for a pint in a pub, or something that we used to do, but I'm sure that we'd all like to do in the future. And small groups. So in Dorset, we are lucky already in that we have got many small community groups that are providing bespoke day opportunities, you know, which is really responsive. And we, across the county, need to move forward. So, for example, Tricuro, the council's local area trading company, provided traditional daycare prior to the lockdown, and since we've been into lockdown, they've provided some safe space places they've not opened their day centres. And moving forward, I don't know if those day centres will ever open in the same vein again. So we need to be creative about how we enhance people's lives in the future. So we really want to work with local communities to seek opportunities. And you know, what I don't want to do is suggest to people that I have got the right idea as anybody in the council, because we are not the people that know. For yourselves. So from the Better Days programme, what would success look like? So co-produced day opportunity strategy for all people aged over the age of 18. So I've got the bones of a strategy that tells me all about the vision and things, but we can't complete that until we've actually got those responses and we know what people want to do. We need a range of flexible community-based models of day opportunity available in local communities that meet individual outcomes. So one of my biggest bugbears is somebody that gets on the bus for an hour and a half to travel somewhere to spend 2 hours in an indoor facility and then get back on the bus and come back for an hour and a half. That's if you can get the bus to start with. And I know particularly in areas like North Dorset, it's particularly difficult to be able to get any transport. So we want to reduce and delay the requirement for care and support, and that's a council strapline through and through, and that's, you know, part of our transformation programme. We want to make sure that the people that require support are engaged and connected in their local communities. You know, if you live in Dorchester, why would you need to travel to Weymouth for day opportunity unless it's what you particularly want to do? Increase the use of technology, including assistive technology. And again, I say we've been working with Vodafone in the development of an app that can be used by people. And that doesn't mean taking away support, but enhancing the support that could be out there. We're in discussions with our transport department to develop transport links and make sure that what we do provide is fit for purpose. Provide employment opportunities where we can for people where they want to be suitably employed, and increase our direct payment and individual service funds, which we are going to be relaunching at the beginning of the summer. Once we've, you know, if somebody that requires support takes a direct payment or an individual service fund, you are literally moving away from the constraints of the council in the provision. So for example, when we have the chat bar came up, I saw there was some community groups, some church groups. You know, it might be that what I actually want to do is on a Sunday go and sit in the church service, but at this moment in time I can't get there. I need somebody to support me to attend that church service. That's just one example. So that is the end of my presentation. Like, as I say, you should probably tell I'm no public speaker, but I am very passionate about day opportunities and where we go for the future, and not being I think what we need to do is in the future, as I say, we have said that we will co-produce strategies, co-produce opportunities, and we've given people 1, 2 or maybe 3 options where this time we don't have that framework in place. So I think it's a really positive place to be starting from at this moment in time.
Lovely, thank you, Sarah. So what we'd like to do now is to split you into groups, not as individuals, but to move you into breakout rooms, which will be hosted either by myself, Sarah, Jade, if you can give a little wave, Jade, just so they can see you, a DCA advisor, and also Joe. And I have to be honest, I haven't got Joe. There's Joe, a little wave there from Joe. So what I'd like to do to maximize the time that we've got, which is about 15 minutes, what I'd like to do is just ask Jade, if you'd mind concentrating on question 2, please, that would be great. Sarah, if you're okay to take question 1 with your group.
Yep.
Joe, if you could also concentrate on question 1. That would be fantastic. And I'll do question 2 with my group. That doesn't mean a lot to you guys out there, but to us, that makes sense. So we're just going to have one question and we're just an opportunity to talk it through as a group. If we have time in the groups, we have got other questions that we can ask. But then we'll come back together. We'll just do a key point from each group, and then we'll talk about next steps. So that'd be fantastic. So Ray, if you're able to spread us to the 4 corners, that would be wonderful.
Okay, I shall do that, and I'll stay in this main room if anybody's got any trouble or anything. So I'll disperse you now.
Very helpful.
That's useful.
Yeah, Sanders, we did. It's good, some good dialogue.
Lovely. It's great to see everybody returning. Thank you so much.
Good.
So I hope all of the groups were as useful as mine. What we'll do is we will collate that information that we got from the groups to put that together, and we'll actually disseminate that out to everybody so that you can see the key themes that were coming out. And then what we would like to do is myself and Sarah will get together and we will look at the information that's come from each of the groups in order to be able to put on another event like this, targeted around the solutions that have come out of today's session, so that we can begin building a plan of how we move forward. And I think the things that people will have been talking about will have been things like having access to decision makers, will have been things like having a single point of contact so that you're not running from pillar to post and trying to talk to 8 different people, maybe possibly some forum, which involves getting people together, and also the opportunities around that micro level of commissioning where you can go from a service user with a direct budget right the way through to a group that can offer a solution. So I would imagine those are some of the themes that people will have been talking about, and others. And I really look forward to going through that information, and we'll come back to you, as I say, with a planned next event, won't we, Sarah?
Yes, definitely. Thank you for joining in.
The other next step that we'll be doing is we will be doing a very small survey, which will go out as a result of this too, collating some of those ideas that you've talked about today, and also some other thoughts that may have come from other partners and other conversations, to ask people to really sort of feed into this process so that we do create something that is meaningful for everybody involved. So thank you. We couldn't do it without you, because otherwise it isn't co-produced, it's prescribed and it's set down, and it probably doesn't work. So by doing it this way, what we get is the input from all of you. So thank you. And thank you, Sarah, for your time this morning. It's really been great. So thank you very much.
Thank you for inviting me.
So I'm just going to do a very quick run through of funding. I appreciate we're at the 12:30 point, so if some people need to leave, I do appreciate that. These funding slides will be available on our website, so you will be able to access them there. But I'm just going to do a quick run through of sort of headlines of funding. Okay. So this one we showed last week, so it's a really reminder for this one. For youth organisations, the closing date is on the 12th of February. So there is a little while, but not too long to get that one in. All of the links will be available on the slides, and they'll take you directly to the application pages. The Comic Relief and Paul Hamill Foundation is a really, really good tech project that's running. This is an extension of their original offer, so it's good to find out more about this. It's a really good opportunity to develop some of your tech skills and training for free by going through this program, so it is worth having a look at for your organisation. Postcode Lottery Trust are just opening up their next fund, so that's opened now, and it has a wide range of areas that they support. It's a very simple 2-stage process. So you do a very small initial application. If you get through to the second round, it gets a little bit bigger, but it's quite a nice staged approach. The 29th of May 1961 charity is a general grant making trust. So there aren't any application dates. So again, it's a good one to look at. The wide range of arts, museums, employment, education, homelessness that they cover is really vast. The Percy Bilton charity is a really interesting trust as well. So again, you can apply it at any time. They do particularly like to finish off bids. So if you've been putting together lots of small bids towards a project, they're a very good one to approach if you're looking for under 15,000. Most of their grants are between 2,000 and 5,000. You need to be supporting one of their priority groups, but actually they're quite flexible on how you spend the money, but they do particularly like to buy items, so something quite tangible. Ray, I'm going to ask you to read the headline of this one for me. Is this, oh sorry, I can see it at the bottom.
Smart energy one.
The smart energy one, it's blocked for me on the screen. The smart energy grant, this is really good if you have any remit at all with vulnerable people who find it very difficult to manage their energy. Then you will definitely be eligible to be part of the support network to tell people about smart energy. So it's definitely worth looking at if you work with any of those groups. Bailey Thomas, again, general grants. So we're not looking at oh no, they do have, sorry, this one does have an application deadline. I should highlight that in bold. I'll do that before it goes onto the screen. So that's Monday, the 1st of March, so a little way off. But they do small and large grants. The National Lottery Community Fund COVID-19 applications are still available. It is inundated, which puts a lot of people off applying, but actually they are getting through the applications that are coming in. So if you are working within the field of COVID-19 and supporting groups, it is still open and it is worth an application. And the last big one really here is just to highlight that the National Lottery are now opening up all of their grants again. So they're reopening them. So that's the Awards for All, Reaching Communities and Partnership. Same standards as before. They are particularly interested in groups that are supporting as part of recovery from COVID-19. So if you're in that kind of realm, you definitely get a priority. But they are open out for non-COVID-19 response applications. And then we've just put together here on this final page a few of those kind of main trusts. So most of these, they don't have application deadlines as such, but they may have funding rounds when they go to their trustee board. But these are all really good, solid trusts that offer reasonable grants between 1,000 upwards, and they're definitely worth a look at. Okay. So that was a very whistle-stop tour of those grants, but it gives you a flavour of what's there, which makes it easier if you come to look at them on our website. All you need to do is Google Dorset Community Action webinars and you'll find the page that way, or you can come through our COVID-19 support page on our website and that will take you to the webinars where this recording, all the slides from today will be available. So thank you for bearing with us for that extra few minutes. And thank you so much for getting involved with today and really helping to make a difference for those better lives, better days projects for the council. Thank you very, very much. And I'll see you all very soon.
Thank you.